Okay, now as you see the pictures, I want to talk about the lateral compartment of the leg. The lateral compartment of the leg, or pronaal compartment. Here we have two muscles, pronaus longus and pronaus brevis, and one nerve, superficial pronaal nerve. And the vessels, the arterial supply is derived from the branch of pronaal artery, which reach the lateral compartment by piercing the flexor hallucis longus and posterior intermuscular septum. In this compartment, I talk about the two retinacula. As you remember, that we have a superior and inferior retinacula. Here, the superior and inferior pronaal retinacula is shown in these pictures. Superior and inferior. This is a superior, and this one is inferior retinaculum. This one is an inferior extensor retinaculum, the stem of the inferior extensor retinaculum. Here, you can see here the pronaal, superior pronaal or superior fibular retinaculum is a thickened band of the deep fascia situated just behind the lateral malleolus. It holds the pronaos tendons in place against the back of the lateral malleolus. It's attached anteriorly to the posterior margin of lateral malleolus and posteriorly to lateral surface of calcaneus. Here, this is calcaneus, as you see here. Attached to the calcaneus in here, and here attached to the posterior border of the lateral malleolus. The inferior pronaal retinaculum, again, there is a thickened band of deep fascia situated anterior-inferior to the lateral malleolus. Superiorly, it's attached to the anterior part of superior surface of calcaneus. Here again, where it become with the stem of inferior extensor retinaculum. As you see here, here is continue with the stem of the inferior extensor retinaculum. As I told you, the pronaal retinacula hold the tendons of the pronaos longus and brevis in place. Okay. Note about the pronaal muscles. Pronaos longus. The pronaos longus origin from the head of fibula, upper 1/3 and posterior half of the middle 1/3 of the lateral surface of the shaft of fibula. If you imagine, for example, this is a fibula. This is the lateral surface of fibula. This is a simple pictures about the medial pronaos longus and brevis. The pronaos longus and brevis. This is a site of origin of the pronaos longus. This is a 1/3 upper, 1/3 middle, and 1/3 lower. As I told you, this attached to the 1/3 upper of the lateral surface of fibula and posterior part of the 1/3 middle of the lateral surface of fibula and head of the fibula. The tendon passed deep to the pronaal retinacula, round through the tunnel in the cuboid, and inserted the lateral side of base of first metatarsal bone and adjoining part of the medial cuneiform bone. This is important point. This is a pronaos longus pass through the one tunnel in the inferior surface of cuboid. This is a cuboid bone. This is a cuboid bone. This is an important point and cross the sole of the foot and finally a joint inserted to the first metatarsal bone and medial cuneiform bone, as you see here. Here, this is a medial cuneiform, and first metatarsal bone is insertion site of the uh, pronous longus. As I told you, is important because the tendon cross the foot, and the pronous brevis lie deep to the pronous longus, and the empty site is origin of the pronous brevis. I can show by here. This is the site of pronous brevis. Pronous brevis attached to anterior part of the 1/3 middle of the lateral surface of fibula, and lateral surface of 1/3 lower of the fibula. The tendon pass deep to the pronal retinacula and is inserted in the lateral side of the base of the fifth. Here, the fifth, this is a fifth metatarsal bone. The both muscles, it means that pronous longus and brevis, innervated by the superficial pronal nerves. The superficial pronal nerves is a nerve of the lateral compartment of the leg. As you know, this is a branch of the common pronal nerves. And about the action, the both muscles doing eversion on the foot. Both of them is evertor of foot, especially when foot is off the ground. Maintain the lateral longitudinal arc and transverse arc of the foot. As you remember, it's important point, the pronous longus and tibialis anterior are inserted into the same two bones. Two together form a strap beneath the middle of the sole. The presence of sling keep the middle of the foot pull up and prevent flattening of its arc. It means that the pronous longus, insertion of the pronous longus and tibialis anterior, both of them inserted to the same points. The first base of the first metatarsus, bone, and medial cuneiform. This is important points. About the superficial pronal nerves. As I told you, the superficial pronal nerve is a one of the branch of the common pronal nerve. Is situated in the lateral side of the leg between the pronous longus and pronous brevis coming down, and the 1/3 lower of the leg is coming in front of the leg, and finally divided to the medial and lateral branch and supply the skin of the dorsum of the foot, except the first cleft between the first and second toe and lateral side of the foot. Okay, now we go to the back of the leg. Okay, in the back of the leg, first of all, started from the back of the leg about the cutaneous innervation. As you see here, in the back of the leg, in the back of the leg, we have some cutaneous nerve. Skin of the calf can be divided into three vertical area: medial, central, and lateral. The like is simple. I drive like the picture, a simple picture for you for more understanding. Excuse me. If you imagine, for example, you imagine that this is a posterior of the calf. If you divide it except to calcaneus, here for example is calcaneus, you imagine it divided to three areas: medial, central, and lateral. For example, this is a medial side, lateral, excuse me, this is a lateral side, and this one is a medial side. As I told you, I divided to medial, central, and lateral area, and in each area we have two nerves. In the lateral side, in the lateral side, and the medial area, first of all started from the medial side. The medial area supplied by saphenous nerves, usually by saphenous nerve, saphenous, and the posterior branch of the medial cutaneous nerve of thigh, medial cutaneous nerve of thigh, a central, this one, the central area here, posterior cutaneous nerve of thigh, posterior cutaneous nerve of thigh, and sural nerve, the lateral area by lateral cutaneous nerve of calf, lateral cutaneous nerve of calf, and pronal communicating nerves. And the lower part of lateral area is supplied by sural nerve again. This is sural nerve. It's supplied to area, again sural. And the heel is supplied medial calcaneus. Medial calcaneus branch of tibial nerve. As you see here, this is a tibial nerve via medial calcaneus, the sural, the red colors, the saphenous here, saphenous, and lateral cutaneous nerve of calf, posterior cutaneous nerve of thigh, and here by medial cutaneous nerve of thigh. The sural nerve is an important nerve in here. I talk about the sural nerves that usually is communicate with and accompany with small saphenous vein. Is a branch of tibial nerve in popliteal fossa. It descends between two head of gastrocnemius. It's as I told you, it accompanies the small saphenous vein. Is joined by the pronal communicating nerve about 5 centimeters above the heel. After passing behind the lateral malleolus, the nerve runs forward along the lateral border of the foot and ends the lateral side of the little toes. It supplies the skin show in these pictures. The lateral cutaneous nerve of calf, here, the brown color here, this area, is a branch of common pronal nerve in the popliteal fossa. It supplies the skin of the upper two-thirds of the lateral area of the leg. And medial calcaneus branch of the tibial nerve, the green color, nerves past the perforated the flexoreticulum and supply the skin of the heel and medial side of sole of the foot. Okay, this is a innervation of the skin of the back of the leg. Please look at the sural nerve. It's a main branch of the tibial nerve, but a sural communicating branch. The sural communicating or pronal communicating branch of common pronal nerve is joined to sural nerves. This is a sural communicating or pronal communicating. This is a branch from the common pronal, but the main nerves is this one. Some texts like this book show that this is a medial sural and lateral sural. Both of them is correct. Finally, we have a sural nerves. Okay, the back of the muscles, as you remember, I told you that the back of the muscles has many muscles. I divided the back of the muscles to two superficial and deep area. In the superficial area, we have some muscles, superficial muscle of the back of the leg, gastrocnemius, you can see here. This is a gastrocnemius, soleus and plantaris. The gastrocnemius, as you see here, has two heads, lateral and medial head. The medial head is larger than lateral, is arised by broad flat tendon from the posterior superior depression of the medial condyle of femur behind the adductor tubercle, the adjoining area on the popliteal surface of femurs, the capsule of knee joint. The lateral head arises by broad flat tendon from the lateral surface of the lateral condyle, lateral supracondylar line, and capsule of the knee joint. In summarize, both of them originated from the medial and lateral condyle and with small area near the condyle. The tendon of these muscles fuse with the tendon of the soleus from the talocalcaneal or talo tendon of Achilles, which inserted to middle 1/3 of the posterior surface of the calcaneus. If you remember, the posterior surface of the calcaneus divided into three areas. The tendon inserted the 1/3 middle of the posterior surface of the calcaneus in here. And the tendon of the gastrocnemius, as I told you, joined to the tendon of the soleus and making a tendon Achilles is one of the important tendon in our body. Here you can see that the lateral head, the insertion of the lateral, origin of the lateral head and origin of the medial head to medial condyle and lateral condyle of the femurs. The soleus, if you remember the posterior surface of the tibia, for example, this is a posterior surface of the tibia. Shown by simple pictures. If you remember, in the posterior surface of tibia, we have a one oblique line that name is sulal lines. Do you remember the sulal line in the posterior surface of the tibia? The sulal lines. This is a this is a sulal line. The soleus muscles originated from the sulal line. Sulal line, back of head and upper 1/3 of posterior of shaft of fibula. I draw a fibula in here. For example, this is a fibula. example, this is a fibula. This is a fibula, and lateral malleolus in here. Okay, the uh, the soleus originated back of head and upper one-fourth of posterior surface of shaft of fibula. I show by simple pictures. Here, it's originated from these lines, the back of fibula, head of fibula, and upper one-fourth of the posterior surface of fibula. This area is region of the soleus muscles. Fibula and tibia, both of them has a sites for the origination of the soleus muscles. And about another muscle, the plantaris, you can see here the small muscles. The plantaris muscles is originated from lower part of the lateral supracondylar line and oblique popliteal ligaments here. The tendon is thin and long, as you see here, the plantaris tendons. The tendon is thin and long. It lies between the gastrocnemius and soleus. Here is a soleus. This is a soleus. And this is a gastrocnemius, as you see, situated between these muscles. It is inserted to superior surface of the calcaneus medial to tendon of calcaneus. Plantar aponeurosis is the estranged part of the plantaris. Okay. About the action, the nerve supply of the posterior back muscle is a tibial nerves. All of the back muscles in the leg is nerve innervated by tibial nerve. Tibial nerves. About the action, the gastrocnemius and soleus are strong plantar flexors of the foot, the ankle joint. The gastrocnemius is also flexor of the knee because the originated upper to the knee joint. As a result, has a additional action in the lower limb. It means that not only doing a plantar flexion in the calcaneal tendon with the soleus, but also doing the flexion in the knee joint. This flexion is important, but the plantar flexion that produced by gastrocnemius and soleus is very important in walking and running. The soleus is more powerful than the gastrocnemius, but the latter is faster acting. It means that the gastrocnemius is faster acting. In walking, the soleus overcome the inertia of the body weight like the bottom gear of a car. When movement is underway, the quicker acting gastrocnemius increase the speed like a top gear of a car. Soleus is chiefly postural muscles to steady the leg on the foot. The plantaris is rudimentary muscles and is accessory to the gastrocnemius. Its functional importance is of transplantation. It means that the surgeon usually use it for the transplantation in the surgery. Okay, in the another area here you can see that the deep muscles of the back of the leg. In the back deep layer we have a four muscles: popliteus, flexor digitorum longus, flexor hallucis longus, and tibialis posterior. The popliteus, these muscles, you can see here, this is a popliteus again. This is a popliteus muscles. Is originated from the lateral surface of the lateral condyle of femur. Origin is intracapsular. Is important point. It's only intracapsular muscles in the lower limb is popliteus, and outer margin of the lateral meniscus of the knee joint. The both of them is important. I rated the is originated from the lateral femoral condyle, posterior horn of the lateral meniscus, and its intracapsular muscles. It is important. This one muscles, this one, the popliteus here, is attached to the posterior surface area, is inserted to this area up to the soleal line. You can see here, this is an insertion of the popliteus. This is a popliteus up to the soleal line in the posterior surface of the tibial bone. About the action, it's familiar. This muscle is familiar to the unlock muscles. If I give a question for you in exam, what are the unlocks muscles? Unlocks knee joint. Knee joint muscles. Bilateral rotation of femur. Unlock knee joint, bilateral rotation. This is the action of these muscles. Lateral rotation of tibia prior to flexion. This is the main action, the unlock muscles. Flexor digitorum longus. The flexor digitorum longus. The flexor digitorum longus. The flexor digitorum longus originated upper two-thirds of medial part of posterior surface of tibia below the soleal line here. If you remember, here we have one vertical line here. This vertical line divided the posterior surface of tibia to medial and lateral part. The flexor digitorum longus originated from the medial side of the posterior surface of tibia lower to the soleal line. This is a flexor digitorum longus. Flexor digitorum longus. And insertion, the base of the distal phalanx of shaft of lateral foretoes, the muscle end in the tendon which divided in 4 slips, one for each of the lateral foretoes, like upper limbs. In the upper limb we have a flexor digitorum longus again with these names. Each slip is attached to the plantar surface of the distal phalanx of digit concerned. The flexor hallucis longus, lower 3/4 of the posterior surface. This area is empty here. Is remain here, but here we go to the posterior surface of the fibula. Again, I draw one line and divided this area into surface. In this lateral part of the posterior surface of fibula, exactly opposite to the flexor digitorum longus, is origin of flexor hallucis longus. Is lower third fourth of the posterior surface of the fibula and interosseous membrane, inserted to plantar surface of base of distal phalanx of big toe, because hallucis means big toe, is inserted to the big toe. Now you can see that the one area from the posterior surface of the tibia and one area from the posterior surface of the fibula is empty. This empty area is site of origin of the uh, tibialis posterior. Okay, this is it. It means that tibialis posterior originated from the posterior surface of the tibia, interosseous membrane, and posterior surface of the fibula. In this area, that and this area. Okay, is it clear? We say that upper two-thirds of lateral part of posterior surface of tibia below the soleal line, posterior surface of fibula in front of the medial crest, and posterior surface of interosseous membrane. If you learn by simple picture is better. This is a tibialis posterior, but the insertion of the tibialis posterior, the tibialis posterior inserted tuberosity of navicular bone and other tarsal bone except talus. Here you can see that the tibialis posterior, it is important point that tibialis posterior is deepest muscles in the posterior compartment, okay, and inserted to the tuberosity of navicular bone and other tarsal bone except talus, other tarsal bone except talus, and insertion is extended into second, third, and fourth metatarsal bone at their bases. Okay, this is important. About the actions, the doing a plantar flexion of ankle joint, inverts foot and subtalar joints, support medial longitudinal arc. Okay, if you imagine I draw the transverse imaginary lines. This is a anterior muscles in the this area is anterior muscles. This one is a posterior. For example, this is a posterior and this is anterior. And here is a medial side of the ankle and this is a lateral side of the ankles. Okay. If you imagine another vertical line, here you can see that tibialis anterior, here tibialis posterior, here you can see pronous tertius, pronous longus, and pronous brevis. Okay, what this means from these pictures? That muscle situated in the anterior compartment, the both of them, doing the dorsiflexion. That muscle situated in this area doing a plantar flexion Okay, this muscle situated in medial side doing the inversion. It means that tibialis anterior and tibialis posterior, both of them doing inversion, but anterior do the dorsiflexion, posterior tibialis doing the this one doing the inversion and inversion, this one doing the dorsiflexion, this one doing the plantar flexion. These muscles doing the same action, eversion. In the eversion, they are synergists, but that one situated anterior compartment doing the dorsiflexion, that one situated in the posterior compartment doing the plantar flexion. This is the important point. Okay, that know about the vessels and nerves in the posterior compartment of the legs. I will come back to the back of the legs. Okay, the tibial, the pronal posterior tibial artery, the main artery in the back of the legs. It begins at lower border of popliteal here, popliteus, between tibial and fibula, deep to gastrocnemius. It enters the back of the leg by passing the tendinous arc of the soleus. This is a soleus, pass under the tendinous arc of the soleus. In the leg, it runs downward and slightly medially to reach the posteromedial side of the ankles here, between the medial malleolus and medial tubercle of calcaneus. It terminates deep to the flexor retinaculums here, and by dividing into medial and lateral plantar artery. It means that coming down and finally terminate in two branches, medial and lateral plantar artery. Medial plantar and lateral plantar artery. In the relation in the upper two-thirds of the leg is lie deep to the gastrocnemius, soleus, and superficial transverse facial septum. In the lower one-third of leg is run parallel to the and 2.5 centimeters in front of the medial border of the talocalcaneus. At the ankle, it lies deep to the flexor retinaculum and abductor hallucis. The branches, the pronal artery is the largest branch. The pronal artery, you can see that, or fibular artery. Pronal artery, as you see in the picture, pronal or fibular is the larger branch. Sometimes this branch is larger than tibial, posterior tibial. Several muscular branches are given off to muscle of the back of the leg. A nutrient artery is given off to tibia. Anastomosis branches. Okay, we have three anastomosis branches. Circumflex fibular branch, circumflex fibular, wind around the lateral side of neck of fibula to reach the front of the knee, is take part in the anastomosis around the knee joint. Communicating branches, malleolar branch, anastomosis with other artery on the medial malleolus here. one calcaneal branch and a calcaneal branch. Here you can see that the malleolar branch, this is malleolar branch, and this one is a calcaneal branch. This is a calcaneal, this one is a malleolar, it's a small artery. This one is a pronal or fibular artery. You can see in here. Midfiend, circumflex, communicating branch, medial malleolar, calcaneal, and two terminal branch, medial and lateral plantar, as I told you. The pronal artery is the largest and most important branch of the posterior tibial artery. It provides blood supply to posterior and lateral compartment. And this is a main pathway of this artery. You can see here. And now about the tibial nerves. I want to talk about the tibial nerves. The course and relation of tibial nerve in the leg are similar to those of posterior tibial artery. Like the artery, the tibial nerve also terminates by dividing medial and lateral plantar here. Medial and lateral. The tibial nerve, as you say, the muscular branch, the tibial nerve supply the posterior digitrum longus, flexor hallucis longus, and deep part of the soleus. Has some cutaneous nerves. Medial calcaneal branch pierce the flexor retinaculum and supply skin on the back and lower surface of the heel. Here, medial calcaneal branch from the tibial, lateral and medial plantar, both of them is terminal branch. Before the termination, the medial calcaneal branch arising from the tibial nerve, the articular branch to the ankle joint. Here in the back of the leg, we have one flexor retinaculum. Okay, the flexor retinaculum. This one is a flexor retinaculum. You can see here. I want to tell you some important fact about the retinaculum. The attachment. The flexor retinaculum is attached anteriorly to posterior border of the posterior border tip of medial malleolus, and posteriorly and laterally to the medial tubercle of the calcaneus. Structure that passing deep to the retinaculum. These are from medial to lateral side. From the medial to lateral side. Tendon of tibialis posterior, this one. Tendon of flexor digitrum longus, the second one. Posterior tibial artery and its terminal branches. Posterior tibial artery and terminal branches. Tibial nerves, the yellow color, and its terminal branches. Tendon of flexor hallucis longus. As you see in the picture, each tendon occupies a separate compartment which is lined by synovial sheath. The blue color is synovial sheath. The nerve and artery share a common compartment. This structure, from the here to here, lie in the tarsal tunnel. The lower part of the deep surface of flexor retinaculum give origin to the greater part of the abductor hallucis muscles. I will talk about these muscles. The tibial nerve can be injured in upper part of the calf by fracture of tibia, in the middle of calf from the thigh plasters, under flexor retinaculum in here. If the injury under the flexor retinaculum, we say that the tarsal tunnel syndrome. Tarsal tunnel syndrome. The sensory loss, distal and middle phalanges, including nail beds of all toes. The sensory loss is in the skin over the sole of the foot. Motor loss if injured at upper part of the calf, superficial muscle of calf, deep muscle of calf, and intrinsic muscle of sole. Okay, this is about the posterior compartment of the leg. In the next session, next lecture, I will talk about the sole of foot and about the joint of the lower limbs. Thank you for your attention. See you in the next lecture.